Ms. O'Connell, I want to follow up on my previous questions to you because I don't feel, frankly, that I got answers. I'm asking you specifically how much money was diverted from the testing budget to deal with the surge of people, including unaccompanied minors, illegally crossing the southern border, and how much money was diverted out of the funds allocated for the strategic stockpile?
Thank you, Senator Collins. Again, all of the funds as they were appropriated to the American Rescue Plan were for testing, contact tracing, and mitigation efforts. Of those funds were used to test unaccompanied children at the border and then to mitigate the COVID positive cases so they wouldn't enter the community and spread COVID, which was a use of the funds that was allowed under the testing, contact tracing, and mitigation requirements.
Well, you're still not answering my question on the amount of money that was used to deal with the crisis at the southern border. So I will tell you that our staff's investigation found that $850 million out of the testing budget and another $850 million out of the allocation for the stockpile were instead used to deal with the crisis at the southern border. Do those numbers sound right to you?
Senator, I'll be happy to take that back and discuss that with our finance team to make sure that those numbers are the same numbers that they're tracking.
Well, I have to say that it's interesting to me that you knew all of the numbers, and I commend you for this, that were going to community programs, to schools, et cetera, but you can't tell me how much was reallocated to deal with the crisis at the southern border, a crisis that, were it brought under control, we would have these funds for the purposes that they were intended. Let me ask you further, what do you mean when you say mitigation as applied to the southern border and the surge, the unprecedented surge of people crossing?
Thank you. One of the important things that we needed to do when we identified a COVID positive unaccompanied child was to make sure, for example, they didn't ride on the same bus to a shelter with a COVID negative child. So there were additional costs for transportation to keep the children separate to mitigate spread, as the statute allowed us to spend those funds. In addition, within the shelters, it was necessary to set up a separate room where COVID positive unaccompanied children would reside so they wouldn't interact with the COVID negative children, and that required additional resources in those shelters in order to keep them separate. So when the children entered the community with their sponsors, they were not bringing COVID into the communities.
Well, I will tell you, having visited the southern border in late March, testing was being done, but people had been there for weeks at a time with no testing. And there were people, adults, who were released into the community with no testing. The fact it remains that if we had the southern border under control, we would be using the $850 million designated for testing to buy more rapid tests. We would be using the money out of the stockpile, the $850 million, for the purposes for which it was intended. So I think that this is a problem that has contributed to the shortage of testing, the uncontrolled crisis at the border. And I also am perplexed by the lack of federal orders for tests between January and September of 2021, which I know from my experience in Maine caused a major manufacturer, Abbott, to lay off 400 workers that were producing those tests because it lacked the federal orders. That makes no sense to me and seems very short-sighted. Thank you.
Thank you, Senator.